Good morning, everyone. How's everyone this morning? This is your monthly forum. We have all the directors lined up and the boss man himself lined up, and we're going to try to answer some of your questions. I hope you all are doing well, and I thank you all for your continued courage and fortitude and staying the course with us all. We're going to get through this. And with that, Grant, I'll turn it over to you, please.
Good morning, everybody, and welcome to our weekly report. We're glad you're able to join us. We're going to start this morning over at the board, and we'll zoom in on the board. Here's the situation as we stand today. There are 975,000 people roughly in Pinellas County, and of that, we've had 729 confirmed cases with 37 deaths. Now, you'll look in the lower right-hand corner, that fatality rate jumped up a percentage point over the last 24 hours. That has more to do with the fact that they have gone back, public health officials, and taken those people who were suspected of COVID-related deaths and now have actually confirmed them and put them into the total fatality statistics. So throughout the state, we're trending at 3.76 and 5.08 in Pinellas County. These numbers will continue to decline rather than go up as more people are tested and the number of individuals who have tested negative or who are recovering start to come online. That fatality rate is going to drop. Nationally, it's already down below 3%, and we're anticipating that it should be somewhere between 1.5 and maybe 2.25. That's more in line with what we're seeing globally, and there's no reason to think that Pinellas County is not going to follow suit. When we look at staffed and licensed beds, you can see that we still have lots of capacity in our ICU, our skilled nursing beds, our hospital acute care beds. So we will continue to track that as these numbers come down. We should begin to see hospital operations normalize and more people going in for elective surgeries and the hospital bed counts transitioning from COVID-related illness to just general health issues. So we are sitting here at just over 1 million cases of COVID-19 across the United States. One of the new figures that we're tracking is the number of individuals who have been tested. And for the state of Florida, it's a little more than 300,000. And so that's part of the governor's plan to reopen the state, is to get 2% of the Florida population tested so that they have a good sampling to do statistical analysis and determine a means of measuring the improvement day by day, week by week. So that process is underway, and I think I mentioned earlier in the week that the antibody testing is going to be available in the state of Florida on starting today and going forward. So we anticipate that the number of test results is going to spike pretty significantly over the next 7 days. In terms of hospitalizations, Pinellas County is sitting at 37 throughout this entire ordeal, and there have only been 16 cases of confirmed COVID in our zip code 33759. All right, we will now turn to Leslie, who can give us an update on our specific tracking here at Regency Oaks. Leslie.
Good morning. We have 4 residents that are being quarantined, but it is non-COVID related. Their returns from the hospital. We have no staff members that are being quarantined. We currently have no staff and no employees who are being tested for COVID-19 or any flu-like symptoms. And again, no confirmed cases on our campus for residents or staff for COVID-19.
Okay, thank you, Leslie, for that update, and we'll now go to the administrative reports. We're going to start with our Director of Financial Services, Sherry.
Morning. My report today is on our March financial statements. Our total revenue for the campus in March was under budget by $6,000. Our entrance fee sales for March were $3 on a budget of $7. Our occupancy campus-wide is 94.1%. Our expenditures related to March for our compensation expense was under budget. Our non-wage expenses, which is our normal monthly operating expenses, was under by $7,000. We do continue to have our weekly spend down meetings related to overtime, expenses, etc. Our net operating income was above budget by $172,000. Therefore, our community has no significant threats or weaknesses at this time. As a closing comment, I'd like to point out that with the COVID-19 situation, we are expecting an impact to our revenue. Our occupancy is down in our assisted living as well as our skilled nursing facility, and our sales have dipped due to the different types of marketing efforts we are now facing. So that is one of our weaknesses that we will be working on overcoming throughout the remaining year. Thank you.
Good morning. I'm Sandra Novacco, the Human Resource Director. During the month of April, we hired a recruiter to assist in sourcing candidates. We also are in the process of developing a new online training portal as well as a new scheduling system for the health center. Additionally, I've maintained follow-up and communication with staff regarding COVID-19.
Good morning. I'm Amy Waugh, Director of Sales and Marketing. For April, we had 5 new deposits that we received that will be closing in May or June. We had 1 financial closing, and we had 2 physical move-ins. Linda Mortensen, who moved into N301, and Sue Clark, who moved into S411. We also created and implemented 10 new virtual visits to help us during this time for selling and getting information out to the community. Thank you.
Hello, I'm Leslie Haas, Resident Services Director. In the month of April, we continued our Sharps collection and our prescription disposal in the Wellness Center. We are working on screening temperatures for residents, visitors, and employees that are coming onto campus. And our visitors are the caregivers for medical purposes that are medical professionals. We are maintaining our quarantine list, constantly updating to keep everyone aware, as well as working with the other directors on the COVID task force.
Good morning. My name is Tiffany Rivers, your Resident Program Director. In the month of April, we recorded the Regency Oaks Board of Directors monthly meeting broadcasted on VCTV. Thank you to all of the board for your participation. We also visited each resident for Easter and dropped off treats to everyone. We wished Henry Qua 100th birthday, so if you see him, please keep your distance while still saying happy birthday. And we also thanked our staff for their hard work with a delicious lunch. Thank you.
Good morning, I'm Rance Macy, I'm the Healthcare Administrator. In the month of April, we converted one wing of the health center into an isolation unit due to COVID-19. So what that means is all new admissions that come into the health center have to spend 14 days on this unit before they can rejoin the regular resident population in the health center. All the staff that work on that unit have to wear full PPE when they're working that unit, and they need to stay in that unit for the duration of their shift. This is requirements within guidelines with the CDC, ACA, and the Department of Health. Things keep changing every day in our environment, and we have to stay on top of those things. So that's one of the things we did. In addition to that, the other things that we're doing is every week it seems like the forms that we have to do for employees when they come in are changing, with a new checklist, new symptoms we're looking for. That's about it. We're still COVID-free in the health center, so that's a good thing. Thank you.
Lauren Rose, Director of Administrative Services. And in administration, we continue to take everybody's temperature, anyone who's entering the building, and they must complete a questionnaire. We're maintaining the logs of information. We participated in the delivery of the frozen treats for the residents to enjoy while watching the afternoon movie. Also distributed Easter eggs to the resident apartments. And we hired 2 new receptionists, one for the health center and one to fill in on the weekend evenings.
Jesse Rosalie, your EVS director. I'm proud to announce that this last month we accomplished the following. We deep cleaned the Arts and Craft Room Information Center models, North and South Fitness Center, first floor North and South employee cafeterias. We cleaned all hallways, windows in South on all floors. We dusted all picture frames in hallways in the South building. We dusted all ceiling moldings on first floor North and South. And in addition to that, we implemented our loaner program, in which you've been very well and participating on. Thank you.
Good morning, Ricky Bacher from Food and Beverage. I have Phil, Johnny, and Michael here with me today. Just a couple updates. We're continuing our delivery service for daily meals. Getting lots and lots of compliments from the residents. I know they love seeing our young servers. We're also doing little snacks. You'll see tricks. What else do we have? Swedish fish.
M&Ms.
M&Ms. So we're just coming up with different ideas to switch it up. Also having Danish and fresh pastry delivered. The lox and bagels, and Sunday's Easter dinner went really well. I'd like to hand it over to Michael, our tavern manager.
Good morning. My pleasure being here today with you guys. I'm the manager for the tavern. I'm here to keep you updated on the upcoming events where we're serving to the presidents. And on the menu we're gonna have on Mother's Day, the 10th, or Sunday, is gonna be shrimp cocktail, lots and bagels, beef tenderloins, catch of the day, and the wine cart. And today I'm gonna serve wine at the North today, so it'll be good today. Thank you.
My name is Darwin Perez. I'm the maintenance director. Here's a couple of accomplishments we have complete through the South Health Center, no building, and Marketing Center. On the South building, we did refresh the hallways, first, second, third floor, and fifth floor. And we also worked on the employees' bathroom. We did refresh the common areas on the fourth floor bathrooms. On the healthcare, we did pressure wash the whole building, the exterior of the building, and we did clean all the gutters on them. On the North building, we repaired the service elevator flooring, and we pressure washed all the covered parking areas. And on the marketing building, we pressure washed and refreshed all the exterior of the building. Thank you.
All right, thank you. That concludes our administrative reports, and we'll now take a few questions from the audience.
You're representing all of you, but your board has been meeting. We have a list of questions from each of you. And the first one is, Brand, the governor has issued his guidance, and it looks like we're still on the hook a little bit with what he said, but when do we think the restrictions will be eased?
Thank you very much. I have had that question once or twice before. So Governor DeSantis has announced that we are moving to phase 1, which is the first of his 3-phase plan to reduce restrictions throughout Florida. The phase 1 reduction of restrictions occurs next Monday, the 4th of May. But Regency Oaks, because we are dealing with an at-risk population that is vulnerable, we were one of the first to impose restrictions. We will be one of the last to lift restrictions. So for Regency Oaks, you should not expect any immediate change to any of our services, whether it's dining, housekeeping, transportation, all of the current restrictions. You can expect that those will stay in place for at least another week. Now, probably early to mid-week next week, we will be announcing what our phase 1 restrictions are going to look like. It is going to be a lessening, but it's going to be layered approach. We will slowly take away some of the restrictions and allow more movement across campus, more social gatherings, but it is going to be a layered approach, taking one small step after another.
Well, second question that we're getting is, I understand transportation is now doing some shopping for the residents with regard to Publix and some other needs they may have. What should the residents expect, and what exactly is being done with regard to this service?
Thank you for that question. First, I just want to thank everyone for their patience and their diligence with this process. It is a learning curve, so thank you for that. What you can do if you need the transportation team to shop for you, the first step would be to get a shopping list out of your mail center. So you're going to pick that up and fill it out with as much detail as possible. Then you will give that list to Tuck, or the front desk can give it to the North Building if you live in the South, and he will schedule you. We are asking that you give us at least 24 hours so that we can add you on the schedule. The team will shop for you, bring your groceries back, and take it up to your apartment so they're not sitting in the lobby. And we are asking that due to COVID-19, supplies are limited, so we will do our best to try to be as specific as possible to your needs, or we will at least make a note of the items that we weren't able to get. But if you have any questions along the shopping trips or the quantity of items or things of that nature, you can always contact Tuck or myself with any questions like that. Thank you. And in addition to that, you will also receive a copy of your receipt and your shopping bags. And we are asking that you do not tip. If you could just put those funds in your employee gift fund box in your lobbies, we would greatly appreciate that. And you will be charged on your bill each month for the shopping trips.
Well, Jesse, the next question is for you. A lot of the residents are asking, what is the cleaning plan for the next couple of weeks? And when can we expect to see some normal housekeeping services?
Sure. Thank you, Don. So I've put together a calendar for the next few weeks to highlight the areas that we will continue to focus in your apartment. So we're going to start with the flooring this week, and then it's going to follow with commodes, vanities, and then following week after that, it's going to be showers, tubs, and then we'll focus on the kitchen. So we'll come together. We came together with a calendar in which it highlights all the areas that we will focus. As far as normal service, we'll love to start tomorrow. However, we are going to continue to monitor the situation, and we will certainly advise once we're ready to do so. The calendar will actually be delivered to your in-house mailbox, so stay tuned. You should find it in the next few hours, starting today.
The next question I have from the residents via the board. Darwin, residents want to thank you for the great job you're doing with regard to trash handling. I know it's dramatically increased. And the question is, what can we residents do to help?
Thank you, Don. We're doing our best, trying to do our best to keep up with the trash, and the residents can help us make sure they tie all the bags, so when they hit the first floor, the trash room, they don't go everywhere. So it will be a lot of help in make sure you tie all the bags before you throw them down the aisle.
In the South Building, we're asking if you could please continue to keep those doors closed and just walk around instead of leaving the trash outside in the service area, to just go around and drop it off by the refuse room.
All right, well, thank you very much for joining us. That concludes our administrative reports for this week. Everyone have a wonderful weekend, and we'll see you again on Monday.